I am Dr. Sarumi. I'm a maternal-fetal medicine specialist, that is OB/GYN physician who has had extra education and training to take care of high-risk pregnancy. I was born in Oyo State, Nigeria, but raised in Maryland. Growing up in Nigeria was wonderful. There are full moons, is what I remember. I remember my siblings and I chasing each other, chasing after grasshoppers, competing on who can catch the most fireflies. I remember my grandpa and his stories about sea turtles under the full moon. I would say both my parents have. My mom, both my parents actually have, sort of exceeded their parents' expectations, both being the only ones with degrees in their family. So just being a trailblazer, that's really encouraging for me and motivated me. When I was 8 years old, my dad had typhoid fever, which is an infection of the liver. I believe he was told that he was having liver failure, he was going to pass away. And so he called us one by one into his hospital room and told us that he was going to pass away and give us all the kinds of instructions of what he would like us to be when we grow up. And about several months later, he came home, and I was delightful, of course, but shocked as well because I thought he was going to die. And, I wanted to know why, like what happened. And he said, the doctors, they saved my life. And I said, wow, as in my little 8-year-old mind, I felt like, wow, I want to send other people's dads home to them. So I'm going to be a doctor. I love being able to be there with women doing a very important journey in their life. So a lot of times it's great. It's very, very, very happy time for women. Sometimes it's not. So I really do love that healing that I can be part of. And so that's really one of the most important reasons why I joined OB/GYN field in the first place. My philosophy is, I am very big on patient education, patient autonomy. It's important for patients to have as much knowledge as possible in order to make an informed consent for themselves. And so I feel most fulfilled when I feel like a patient understands and can grasp what's going on, the diagnosis and or the syndrome that's occurring to them or to their family member, and then they're able to use that to make informed decision for their own health. I'm also very big on patient safety. I believe that standardizing care helps to not miss things and helps to help others who may not be familiar with a certain diagnosis, for instance, to quickly help the patient. And so standardizing policies, standardizing healthcare is a way to increase patient safety, and that's something that I'm also very passionate about.